If you've ever been worried about developing diabetes, heart disease, dementia, obesity, then it's necessary to know about inflammation. The way to think about this is the body is capable of fighting oxidation and fighting inflammation. What can we do from a nutrient perspective, nutrition perspective, to help the body do that? So welcome to drashori.com. I'm a board-certified family medicine physician. My name is Dr. Ashori, and here I talk about healthy aging. Today's topic, anti-inflammatory foods. The big topic here, the big important topic to discuss, is that there is not one particular anti-inflammatory foods, but there are probably foods that are going to increase your risk of inflammation. And it's true that it could be a little bit individualized, meaning one person might react more to dairy, another person might react more to preservatives. But in this video, I'm going to kind of go over the big arching topics that I think is going to affect everyone or be of interest to everyone. So three objectives is to decrease inflammation in the body, which is going to help decrease chronic diseases, and to increase nutrient content and decrease calorie content. Because for the most part, as Americans and anybody living in westernized nations, we probably get enough calories as it is. And maybe another way to step back and talk about superfoods or anti-inflammatory foods is the idea that omega-3 fatty acids or vegetables and fruits are going to somehow decrease inflammation has not been shown to be true, because we also see some individuals who, when they're having an inflammatory condition like irritable bowel syndrome or a flare of diverticulitis or even Crohn's disease, sometimes decreasing certain foods that are naturally anti-inflammatory is necessary. For example, there is a specific diet called the FODMAP diet to decrease the amount of fermentable fibers that would create a lot of bloating and inflammation. Instead, think about what does cause inflammation. So we know lifestyle factors that cause inflammation, but food factors, it's probably going to be sugars, fructose, anything ultra-processed, certain oils, types of oils, and preservatives, excess salt, sugar. Those kind of things are always going to create inflammation in many ways. On one hand, they're going to increase the amount of insulin in your body, they're going to increase the amount of sugar in your body, they're going to cause inflammatory reactions in fat cells, in the liver. They're also going to decrease the ability of the body to absorb proper nutrients. They can cause an abnormal shift in the gut microbiome. So those are the things we're trying to affect, we're trying to change. A good anti-inflammatory diet is generally a diet where you're eating mostly whole foods that are minimally processed. In fact, I would pay less attention to the macronutrient content, like am I getting enough proteins, am I getting enough fats, but pay more attention to the food being whole and minimally processed. So that's going to be fruits, vegetables that are lightly cooked, sautéed, steamed, baked, and it's going to be meats that are coming from really healthy sources, other lean proteins, whether you like it from eggs or tofu or tempeh or beans. And these foods naturally are going to decrease or help the body fight inflammation. They're going to decrease the oxidative stress in the body. They're going to help the inflammatory markers decrease. They're going to help inflammatory biomarkers like CRP and ESR decrease. In fact, many rheumatologists help their patients with integrative ideas of what to change in their diet to help decrease rheumatoid arthritis flares, lupus flares. The things to avoid, as I mentioned, are going to be anything that's pretty much ultra-processed. So think of your food as a mostly whole plant-based diet with some healthy fish, some healthy lean meats in there. And you can probably introduce something ultra-processed, like a few sauces that you make. So it might be a tahini sauce, it might be some sort of a green Mexican salsa, and that's going to be a little bit more processed. It's going to have a little bit of vegetable oil or coconut oil or olive oil. It's going to have some salts and spices. That's the level of processing that you want to engage in. Beyond that, there's going to be a little bit of a risk. So when it comes to anti-inflammatory foods, of course, inflammation is something you can actually measure. There are good biomarkers, blood tests, that you can measure inflammation, CRP, ESR, and some other more detailed ones that are helpful for people with major autoimmune conditions. But you can also look at your skin, look at your joints, look at your energy recovery, look at your sleep, whether you're experiencing some brain fog. All of those are also really good ways to determine if there is some inflammation in the body. So when it comes to food itself, absolutely focus on something that's good and don't limit yourself. If you are finding a really good, healthy dish that you made for yourself, don't worry about cutting it down to like a smaller calorie portion. In general, data shows that if you're eating healthier, it's probably more important to pay attention to that than trying to just cut calories. In fact, that alone will decrease enough inflammatory markers to fight obesity. And other important ones to consider, chewing. Make sure you chew your food properly. Certain undigested products getting into the large intestine and even the small intestine can create overgrowth of bacteria, and it can create excess amount of gas that can actually cause inflammation and cause other digestion issues. Let's leave it at that. Try to eat slowly. Don't eat fast. Rapid eating is a very kind of like an American thing. Just because we're always on the go, we're doing a lot of stuff, we're go, go, go. A lot of other people from other countries sometimes watch us eating and they're like, wow, these guys eat fast. And third, try to eat socially. Try to eat with other people. Not only does that slow you down, but there is also a bit of a conversation piece. Your stress level is lower, and that also can help decrease inflammation. Guys, go to drashori.com for more information.